Human papillomavirus, or HPV, is still the most common sexually transmitted infection. In fact, about 79 million in the US have HPV. It's a public health crisis because there are so many associated cancers with HPV, including cervical cancer in women. Now, the vaccine uptake rates for the nation are quite sluggish, but in Oklahoma, our uptake rates are even lower than the national average. What is consistent in the literature is that when a healthcare provider makes a strong positive recommendation for the vaccine, their patients are more likely to follow up and get the vaccine. But what we don't know is what is the content of that message. What are healthcare providers saying, especially to college students? I'm Tracy Freudenthaler. My research partners, Ms. Elbon and Dr. Schumacher, looked at a subset of data from a larger fall of 2020 study, and we looked specifically at vaccine status in these students. We looked at whether or not a healthcare provider had made the recommendation, and we also looked at a qualitative question, which was what information has a healthcare provider given you about HPV? 84% of the respondents said they had the vaccine, and about half of them reported a specific message beyond the recommendation. They told us in these open-ended questions their answers. We used inductive open coding to categorize themes, and they are in front of you in the center of your screen in the results. Some of these salient themes in the provider messaging was that HPV causes cancer. One student said it's an STD that can cause cancer in women. Another simply said HPV can cause cancer. Another remembered that their mom had cervical cancer and died from it, so their healthcare provider had made that recommendation to them when they were younger. Another thing we found is that providers gave written pamphlets or brochures. One student said they gave me paperwork that talked about the benefits of having the vaccine. Another small group of students said the vaccine is beneficial. Their provider had told them it's important to get it before college or that it's important. Another group of students said that vaccine reduces HPV risk. This particular student said that a vaccine will reduce my chance of getting it. Another said that the doctor told them HPV is very common, it's easy to get, and I should be vaccinated so that I am not at such high risk. These messages are important, and we are pleased in our results to have gotten some better understanding that healthcare providers are a source of information for the students that were vaccinated. But we also found that there was a group of students that didn't have the vaccine recommendation, and they didn't report specific messages. And further, when we looked at these messages, we realized there was not a lot of consistency among these messages. If you notice again, only about half of our students recalled specific messages. Some of the messages we found were a little confusing to us, or perhaps inconsistent. Let's give an example. One student that was a male student said the doctor gave them paperwork, but mainly emphasized how it won't necessarily harm him, but could harm a future girlfriend. Another student said that, again, beyond just getting that vaccine recommendation, that they were never really told what HPV was, but just that the vaccine would reduce their risk. I think that the results show us that, again, for students that had the vaccine and got information, the providers were a source of influence. But without consistency in the provider messaging, it's concerning that college students might not be getting the proper information. College students are still prime candidates for catch-up vaccinations. Supportive recommendations from healthcare providers, maybe even at student healthcare clinics on college campuses, can positively influence and sway these vaccine decisions, especially in an age group that is almost aging out of their prime eligibility to get the vaccine and be protected.